I heard along the grapevine that you left your lucrative career in medicine for greener pastures. Is that right?
Yeah, well, I left medicine and decided to do business instead. So I did 2 months after I graduated, and then I just decided to do business. And currently, I do a business where we customize lights and then ship them out all over the world. So it's totally different.
That's crazy.
And essentially, I liked medicine when I was studying it.
Okay.
Because there were a lot of interesting problems to solve and a lot of interesting things to learn about. But I realized that learning about medicine in university and doing projects, things like that, and then actually practicing medicine are two different things.
Okay.
In hospital, there's very little opportunity to do deep work, to enter a flow state where you're totally focused on solving a difficult problem. It's really going from one thing to the next thing to the next thing every 5-10 minutes. So you're not able to produce a lot of what I would say work which is valuable in the long term. In research, you could do that.
Okay.
But in the hospital setting, if you're a doctor treating patients, a lot of your time is involved in admin work, is involved in paperwork, and very little time is given to actually treating patients and to do deep work.
Okay, but I think perhaps somebody could argue that, by being that hospital doctor who is delivering care to the patient, you're making a real difference to that patient's life.
I agree, so it's a very crucial role in terms of being a doctor.
Okay.
But I would say that in terms of the broader picture,
right,
you are following the protocols which are given by the NHS or anyone who you're working for. So in terms of solving new problems in the world, I think there's a limited scope for that. There's a scope in research, but at the same time, research takes many years to be implemented.
Okay.
In business, you could implement a new idea tomorrow. Whereas in medicine, it will take years for a new idea, a new drug, a new vaccine to be implemented. And there's very limited scope in terms of that.
Okay, fine. Now, is there anything that, through your decision, do you have any regrets leaving medicine?
Well, no, actually, I don't have any regrets. I'm really glad I made that decision, and I'm really happy. Every day I get to do kind of what I want, and I look forward to working every day. And really, I'm working all the time because I really enjoy it, and you can choose the problems to focus on, whereas in the hospital, you are given problems to focus on, even if that's tasks which you don't want to do. So I'm really glad that I took that decision, but it's not for everyone. I think medicine has a lot of advantages as well. For example, you are making a real difference to people's lives in a material way, and that is something which is very hard to replicate in any business.
Okay, that's cool. Now, is there anything that you would say perhaps to your younger self when you were at that position, or to somebody who might be going through something similar right now? They may not be leaving a career in medicine entirely, or they may just be making a change in their career, whether that's within or outside of medicine.
So I would say change is good, and you should be, if you are thinking about changing your career, then investigate all the options and things, but at some point you have to be brave enough to make that decision. And if you can try out the new thing for 1 or 2 years with a fallback option to go back to medicine afterwards, or to go back to your original career, then I would do that. Because if you're not experiencing every day joy in your work and feeling really happy to be working, then I think there's always a better thing out there. Steve Jobs said, don't compromise on finding your dream job or finding that work where every day you look forward to going into work and you look forward to working on whichever problems you want.
So you said something interesting there actually, where you said about have that fallback option if you can.
Yeah.
But then I've also read this thing where you there's this idea of you burn the boats.
Yeah.
Can you expand on that a little bit?
Yeah. I heard Tony Robbins saying something about that, where if you have a plan A, but you also have a plan B, then plan B will distract you from plan A. So you have to really burn the boats. And there was a general a long time ago in war who was said to, I don't think he actually did, but he burned the boats so that when his army was on the island, they had no choice but to win the war because they couldn't go back out of the island because there were no boats to go back on. So there is an idea where you burn...
Sounds like a risky option.
Exactly, it's a risky option. But for some people, it will definitely work. For example, Elon Musk is someone who burns boats all the time, where he would be like, put all his money, which he got from PayPal, into his new thing, Tesla or SpaceX or whatever. So I think it can work. You have no option but to succeed. But first, I think you need to just little bit verify that your new idea is actually liked by people, or it can actually be like, it can actually,
feasible.
it's actually, no, the fact that it will actually add value,
Okay.
that people actually want it.
Sure, yeah.
Otherwise, you could have a really poor idea and you think you just burn all your boats and then no one really likes it. So I think, for example, Elon Musk, electric cars definitely were going to work. It's just how they were going to work.
Yeah, sure.
So he burned all his boats, put all his money in Tesla, and then it worked. So yeah,
Sure.
I think there has to be some kind of proof that the new thing you're going into, there's actually a demand for it.
Regardless, there needs to be some level of risk as well, I guess.
Yeah, exactly.
Yeah.
There's definitely risk. The risk may be in the execution, but in terms of the concept, I think like it needs to be something which you know that, yeah, like 80%, if I can do this thing and execute it, then it will work.
Okay. It's really interesting. So essentially, you've left your career in medicine, and it sounds like you really have truly burnt the boats.
Yeah. So yeah,
You're not
I'm not
wanting
gonna
to go
definitely.
back.
Yeah, definitely.
And one of the important things I think you said was this idea that you shouldn't compromise on finding that dream job.
Yeah. So Steve Jobs says,
Yeah.
never settle. Don't settle.
Never settle, yeah.
Never settle. And so, yeah, if you are thinking of changing careers or going into a new business or writing a book or like
Whatever that
doing
path may be,
your-
yeah.
doing what you like, yeah, just I would say just go out there, try it, and then do it.
Yeah, because I guess we spend more of our hours in the day and in the week doing work than we do
Yeah.
spend at home.
Exactly. So yeah, I think do work that you enjoy and you'll be really happy.